Twindemic, sponsored by TriHealth.
Hey everybody, welcome back. We are here live, still in our noon broadcast here, but we are going to bring you something that we haven't had a chance to talk about yet this season. We call it the Twindemic because it is the flu and COVID-19. And as you noticed, cases of COVID-19 are climbing, but the flu already here as well. So we are here. We are joined by a team from TriHealth, and we have experts in a variety of areas today to answer your questions. You can submit them on the Liz Bonis Facebook page, #COVIDFlu. Or you can do that through Twitter, same #COVIDFlu. What we're trying to do, as we all know, is keep our community open. Most important thing we can do is continue the path forward right now. So I'm going to turn this right over to our providers while your questions are coming in, and start to my right. My immediate right is Dr. Stephen Blatt. Tell us who you are, what your profession or specialty is. And by the way, we are 6 feet apart, so I can keep my distance. And so we space them out as well, so at least if they take a mask down, you can understand them. So Dr. Blatt, take it away.
Hi, I'm Dr. Steve Blatt, Medical Director for Infectious Diseases for TriHealth.
And we've been kind of following your work throughout. Been pretty busy these days?
Yeah, it's incredibly busy in the hospitals right now, and I know in the office is very busy as well. We're seeing lots of patients with COVID, and we're starting to see flu cases as well.
So one thing today, I got to ask you, because you're the specialist, we're hearing now that there was a new antibody treatment today. Are we excited about it?
Yeah, so there's a new monoclonal antibody. It looks like it works to prevent people from needing to get admitted to the hospital if they're older or at higher risk. We don't have the product available yet. It's going to be on limited distribution when it first comes out. But it looks like it does help prevent patients from needing to get admitted to the hospital.
Now, my understanding is you have to deliver that through an IV, don't you?
Right, so it has to be given in an infusion center. So TriHealth is setting up several infusion centers around town that once we get the product available, we'll be able to provide that treatment to our high-risk patients.
All right, thank you very much. We're going to go on to your colleagues there. Please tell us who you are, what you do, and what you're seeing for COVID and flu these days.
Sure, I'm Dr. Denise Warrick. I'm the Associate Medical Director for Pediatrics for TriHealth. We are seeing plenty of kids in the office now with both flu and COVID these days, and so we're really just trying to minimize kids from getting sick, period, so that we can keep them playing the sports that they want to do and also attending school.
So that begs to question then, are people still as nervous about it? Are they getting tired of dealing with it? Are they coming in asking you still a lot of questions?
We're seeing a lot of COVID fatigue, and I think what we're trying to really enforce to families is that we really want kids to do the things that they normally like to do, doing the sports, gathering with friends, but we're just really encouraging people to be smart when they do it. So limiting both the frequency and the size of the gatherings of people that they're around, as well as just being distant. So using social distancing, using ventilation, so being outside when possible, and also just really good hand hygiene as far as being careful about that.
All right, we're going to have lots of questions about kids coming up. Thank you so much for being here today. Let's pass it on to your colleague here. Good afternoon to you.
Hi, good afternoon. My name is Dr. Madiha, and I'm an OB-GYN with TriHealth. My practice name is Associates in OB-GYN.
So I just read a really interesting study that said pregnant women are having a tough time in some of this. Just can't have everybody around you as much. You're scared about the baby. So how are you supporting them?
Yeah, so right now the biggest advice I give my patients is do whatever you can to protect yourself and protect your baby. Your baby's completely reliant on you as they grow inside you to stay healthy. And I think our pregnant population is doing a really good job with protecting themselves. We luckily have not seen too many cases in our pregnant population on an outpatient setting.
All right, well, we have some questions about that coming up as well. And finally, I want to reach out to our internal medicine specialist. Hello there, good afternoon.
Hi, I'm Dr. Robert Travez. I'm a primary care doctor with TriHealth.
And I know primary care has just been really busy with a lot of things. What are you seeing for COVID? What are you seeing for flu?
So we're seeing a lot of symptoms that we can't really definitively say if it's COVID, before testing. We can't say if it's flu, because the thing is that everything overlaps, or there is a lot of overlap, I should say. What we are doing is we are implementing protocols to make sure that we are limiting the risk that patients are exposed to. If you're symptomatic and if you're complaining of respiratory issues, we ask that they're evaluated by a Zoom visit, as opposed to actually being in the office and exposing other coworkers and other patients to risk. So we try to really stratify what's going on and try to triage things before they develop into bigger problems. Ideally, we don't want people to be admitted into the hospital. We want to know what the issue is before it snowballs into something larger.
Okay, so are you the person that's going to be comfortable giving us the flu vaccine? Is that what I'm told?
Yep, that's me.
All right, so this is why we're here today. I want to tell you guys something. Our health team actually waited to get flu vaccines, and so we asked the team here, hey, could we get them on camera to show people that we really support this and believe in it? And so I'm going to head your way over there, and I'm going to, actually, I might have to have you come this way if you don't mind. I'm going to have you come over here. Can we grab the flu stuff, and we're going to get set up. And Murby and James are here as well. We're all getting flu shots, and we're going to be kind of just sharing a little bit more about that. But while you're headed this way, I wanted to ask you if you're hardwired, so you got to kind of unhook there to do that. What I want to ask is, I guess maybe I'll start and go back to Dr. Blatt, and he can talk us through that. COVID compared to flu. We heard it started on the West Coast. Is it soaring here yet? Is it sporadic? Is it enough to count numbers? What's going on?
Yeah, so far flu is very sporadic here in the Cincinnati area. Fortunately, we're not seeing a lot of numbers, but we are seeing some, and that means that we're at risk for having it spread more widely. The COVID is really widespread right now. We have more patients in the hospital than we've ever had throughout the whole COVID pandemic here in Cincinnati, and all the other hospitals are really stressed trying to provide care for all the COVID patients as well as take care of all the patients with other issues as well.
Well, I know what you've been doing is impressive, so I'm going to invite you in here. I got my mask on. Now, before anybody panics, I'm going to, I have a T-shirt on, okay? But the reason that we're doing this come up, because I know you'll have to kind of invade my personal space. What I want to have you tell us is, why should I get a flu vaccine? Is that going to help the healthcare system? Is it going to help, keep us from getting sick? It won't keep you from catching COVID, but why do you encourage this?
So that's a very good question, and there's a lot of answers to that. First of all, this is the first time in a long time that we're experiencing the flu in the setting of a global pandemic. So you want to make sure that we're protected from all angles. There's a lot of misconceptions as well. A lot of people come into the office and they say, oh, well, I got it 2 or 3 years ago, I should be fine. Unfortunately, the flu vaccine doesn't last forever. The strength of it and the efficacy of it starts to wane after a certain amount of time. So that's why we have yearly vaccines. That's one thing. Another thing is that it's really incumbent upon us as a group to really kind of push forward and actually take responsibility for all of our healthcare, because my health or any issue that I'm facing with could possibly put anybody around me at risk. So that's another important aspect to keep in mind.
Okay, well, part of the reason that we wanted to get these, I'm going to pull my sleeve out here for you, is that we really want to make sure that, if I can not catch the flu, then I'm not in the emergency department, right? I mean, that's going to make a difference right there. Sorry. All right. So there went the bracelet. Okay. So I'm going to leave this arm out. Can you give it the right arm? Is that okay?
That's totally
all right.
Yeah.
So what I'm going to do is, while he's giving me a flu vaccine, we're going to stay on this, but I'm going to go to our OB-GYN. I know this has been super important for women who are pregnant. And what are you telling them about flu vaccination?
So flu vaccination, again, not only protects our pregnant patient, but protects the baby by giving passive immunity to the baby once they're born. A newborn isn't able to get the flu vaccine until they're 6 months of age. So they're completely reliant on mom to get the vaccine and to give them that passive immunity.
Okay, he's telling me small pinch. Yep, that's what it feels like. I know that the needles for this have gotten thinner. That's a good thing. I'm having them give it in my right arm because they say if you exercise the arm after, then it doesn't hurt as much. Is there truth to that?
That's correct. The most common complaint that we get in the office is some local pain and tenderness at the injection site. At the end of the day, it is an intramuscular injection. It's something that we see, commonly. But that's not a huge concern. We don't feel that's an extreme, complication of this. It's just something that's very common.
Okay, excellent. I'm going to invite Murby Curtis is our health producer. The health team really supporting this. She's going to come up, and we're going to let you give that vaccine to her. We're going to continue with our pediatricians. How are you doing with flu vaccines this year? Are people getting them?
Yes, we're encouraging people to get the flu vaccine for the same reason they mentioned for the mom and baby. So for the little ones at home, the kids that are 6 months or younger, they are not able to get the flu vaccine. So we really have that, herd immunity, and kind of having family members around them are the best way to protect the infant from getting the flu. Also, too, with kids being in school and also in other activities, we're just really trying to minimize if there's any way to protect against an illness that we can prevent. We're really, trying to encourage to do so. Same thing go for other, vaccinations at this time for vaccine preventable illnesses.
Okay, I'm going to get out of the way here. We're going to let Murby get that, and I'm going to continue this conversation. Dr. Stephen Blatt, are you seeing hospitalizations yet from COVID or from the flu?
We have had maybe 1 or 2 flu hospitalizations so far, so it's still very early in the flu season. I do have concerns about after Thanksgiving when everybody comes together and we end up having people coming from all parts of the country gathering in groups, that it's very worrisome that we could have true outbreaks of both flu and COVID pandemic.
All right, sorry, we're a little distracted here because we're still getting shots, but I'm glad to hear that. Okay, so keep this line of questioning going. I've been hearing a lot about so I get a flu shot, it doesn't protect me against COVID, what's the point?
Well, you don't want to get both viruses at the same time because COVID alone can be bad enough, especially if you have chronic medical conditions. If you get the flu on top of COVID, outcomes will not be good. So if you can protect yourself from flu with the flu vaccine and you can prevent other people from getting the flu around you, it'll go a long way to protecting the whole community.
Okay, that was actually Sarah's first question. She hadn't heard much about the flu and she wondered what was going on. So let's continue. We've got some rapid fire questions. Murphy, how'd that feel? Wait a minute. We got to ask her here. You barely felt it, did you?
Barely did. Nothing. It's just like a pinch, and that's it.
Just like a pinch. All right, James, you're next. You let us know when you can take a break. He's like, I can't take a break right now, but we do have one more. So you just gave both of those. We barely heard it. Tell me the truth. Didn't they make those needles smaller recently?
Well, yes. I mean, really, we want to make sure that the comfort of the patient is something that we keep in mind also. If it's too uncomfortable, if it's too painful, then no one's going to want to take it. So that's something that we keep in mind also.
Okay, what do you think our best chances to get that big guy right there who's been waiting for a flu shot?
I'll try my best.
All right. Not getting out of that one there.
He looks pretty fast.
I know. Yeah, we're all giving James a hard time here. He's like, what am I going to do with this camera thing? Okay, so we want to rapid fire a few questions that have come in from our viewers. I know, Murphy, when you get a second, we'll let you go back and see what's coming in on our hashtag, which is COVID flu. Let's see if we can go kind of right down the line. Do we have any idea if the vaccine is effective yet? I'm sure kids and parents are asking you that.
Yeah. So in past years, unfortunately, the flu has fallen victim to some of, the community, gossip about not being very effective. And we agree it's not 100% effective. But what we do tell people is that, for both kids and adults, the flu can be deadly. And so what we really want to reinforce is that, the flu can even make you have a much milder illness than you could have otherwise. And so, certainly it's not 100%, but certainly it can make it a lot less severe than it could have been otherwise.
And usually a little bit into the season, we sort of start to find that out,
It's a little bit too early to tell at this point, but hopefully we'll know some more in the next couple months.
Yeah. All right, let's move on, and we're going to have you kind of go back to your spot there so we can continue that. Oh, James is coming over. All right. James, where do you want to go? So Greg's going to run your camera. We got James getting the flu shot here, and I'm going to get out of the way. So while he's giving James the flu shot, wait, don't duck out of the way. You guys got to duck in. Come on, James. Got to duck in a little further there. All right, hang on. I'm going to move out of the way so we can get them. All right, can you tell me, I got a great question from Nancy. She said, we're telling everyone to wear masks, and I'm sure you tell your patients that too, but then the coronavirus still keeps going around. So does it work? Should I bother? What's the point there?
I think the mask does, most definitely does work, and then the spread is likely happening just because of certain restrictions as far as quarantining and social gatherings have been very lax in the past couple of months, which has promoted the spread. And overall, just like my colleague mentioned, with COVID fatigue, people are tired of staying inside, tired of being antisocial, tired of having Zoom meetings with their friends, and they're getting together, they're assuming everyone's healthy, and not necessarily taking into the account that someone may asymptomatically be spreading the virus.
Yeah, all right, well, that COVID fatigue. Okay, we want to thank you for our flu shots. That wasn't bad at all, gang, was it? Murphy got one, James got one, thank you. All right, I'm going to go back to my spot here, and I just want to kind of continue this line of questioning. You just gave us that. What are you seeing with your patients with COVID fatigue? Because we've just had an incredible kind of run of people saying, let's be practical here. I'm not going to stay away from everybody I love and know anymore. It's been too long. What are you telling them?
So, it's important that you really establish what's important regarding social distancing, regarding staying at home, regarding avoiding big crowds. And we have that conversation multiple times a day. Some people are more willing than others, admittedly. But really, I think you really reach the patient when you actually take the time to explain what the bigger picture is. And it's bigger than just me or my patient. It's really a global issue. So when you try to hammer that point home, I really feel that patients understand it better. And that's probably one of the more important parts of the conversation that you have. You just want to make sure they understand what we are doing and why we're doing it.
You know, and I think all of us feel that way. Nobody wants to get someone else sick or whatever. It's just sometimes a hard reality kind of every day. I know, Dr. Stephen Blatt, you've been working with that. I got a great question here from Casey, and it has to do with the vaccines. And it says, how do we know you can get the coronavirus vaccine that we're expecting to get if you just had a flu vaccine? Do we know that you can use those two together?
Yeah, so in the coronavirus studies, they have had patients separate by at least 2 weeks between the flu vaccine and the coronavirus vaccine. So that is actually part of the clinical trials for the vaccines, that you could have had a flu vaccine as long as it was at least 2 weeks separated from your COVID vaccine. So we do know the two can go together.
Okay, good to know, because I know you kind of study things together there. All right, got a great question from Quentin. I'm going to go right next to our pediatrician, and I know this really impacts kids and families. I keep hearing about more lockdowns, but if the first ones worked, how come we have so many cases now? I don't want to stop doing everything I like, including sports.
Yeah, and I think it's the asymptomatic transmission that we're really underestimating, that people are having very mild symptoms, and that's the hard part in pediatrics, much like our adult medicine colleagues, is that kids are coming in what they think is seasonal allergies or cold type symptoms, and we really don't know without further testing if it's COVID or not. And so, they're trying to be, good stewards. They're trying to do their best and act in the best interest. But, in prior years, they may have sent their kids to school with those same exact symptoms. And so it's really challenging for parents to navigate that. So I think we're trying to really be systematic this year and kind of encouraging people to get tested if they do even have mild symptoms, to really protect both the patient and also protect their families and all their, their communities. So.
All right, it's good advice. Let's keep these questions going. Christy had a great one, and I love to ask the OB-GYN person this because, if you're pregnant right now, you just want to celebrate with your family, and her question was, how many people can I have over for Thanksgiving? Not easy, but important.
Yeah. Is she pregnant? Or?
Well, no, that's a good thing to ask.
Yeah.
It makes a difference, doesn't it?
Yeah. So I would say no more than 10 people, and again, try to follow CDC guidelines, being outside in an open environment, not being in an enclosed dining room, sitting 1 feet apart from each other. And again, you got to do everything you can to protect yourself if you're pregnant, to protect your baby, and to protect your loved ones.
And can you elaborate on that? You already do something called cocooning, don't you? Like, for example, with whooping cough and things. Is this sort of like that?
Yeah, it's just like what we mentioned earlier with passive immunity. So the baby is completely reliant, the pregnancy is completely reliant on the mom to get vaccinated in order to achieve immunity for when they're born.
Yeah, so, if we think of it like the flu, lots of moms will say, I don't want the flu to be around, my baby. And so if you haven't had a flu vaccine, don't come close. All right. Barb had a question that I think Dr. Blatt answered about you can get the flu and COVID-19 at the same time. And then let's go on to Stevens. So we're all kind of worried about this. I know you're doing your part to keep people out of the hospital. He wanted to know, what can we all do to keep out of the hospital so we don't overwhelm the healthcare system? And I think it's important because we almost don't want to go to the hospital, but at the same time, I suppose it's important that you do call your doctor and find out when you should get admitted.
Yeah, I mean, and that's essentially it. You have to maintain open communication with your physician. We're not being bothered when we get calls from our patients. In fact, that's what I really love to see, because when you have that communication and you have that doctor-patient relationship where it needs to be, that's when you can have these conversations about symptoms, about any issues or questions or concerns, exposures, risks. And when you have these conversations earlier on, when you get that education and when you get those instructions from your doctor earlier on, you can prevent a lot of things, including hospital visits.
Yeah. All right, we have a little video of some of the intensive care things and that. We're just winding down here. I want to give you each just a chance to wind up. Dr. Blatt, tell me a little bit about, ICUs and emergency rooms. Can our hospitals handle this, that kind of thing?
Yeah, so the emergency rooms and the intensive care units are pretty full. But so far, the hospitals in Cincinnati are weathering it fairly well. We are sharing patients, so if one hospital gets too full, we'll transfer patients to another hospital, at least within the TriHealth system and probably between hospital systems as this current surge grows. So we have capacity right now, but everyone is stressed.
Yeah. Okay. Well, it's good to know, and that's why we all need to do our part. All right. Want to let you wind down with we're not hearing as much about that horrible immune system stuff with kids. You know, are we getting better at dealing with it? Are we not seeing it as much? Do we know?
Yeah. So the MISC, or the multi-inflammatory system condition, is what we had been hearing a lot as far as patients that had been sick with COVID, and it would be like a few weeks before they present with this more serious condition. And so thankfully, you know, we haven't seen it yet, but again, we're early into this current surge, and so we'll have to see over the next couple weeks if we see any presentations of that. But luckily with COVID, you know, kids are more mildly affected, and we're hoping that that continues. So hopefully we'll know more soon.
Mm-hmm. All right, give us your final thought. I've been asked, even for pregnancy purposes, do we have enough flu vaccine this year? You know, tell your patients we have plenty?
Yeah, we have plenty in our office, and we have plenty throughout Cincinnati from what I know, so get your flu vaccine.
All right, good deal. And want to get a final thought from you. How do I know that the coronavirus vaccine will be safe? And one of the bigger questions about that is I have heard that there is just a whole new healthy fear that a lot of people have about newer vaccines. What are you telling your patients?
So, you know, there is always going to be that sort of question. Is this good for me? What's going to happen? Are there side effects? And in medicine, when it comes to any sort of therapy, anything that we give our patients, there is a risk of there being some sort of reaction. We are working diligently to make sure that we are staying in touch with them, to see how they're feeling, to follow up with them, to make sure that they know that they can reach out to us. And, you know, in a bigger picture, health authorities from around the world are researching this to make sure that what we put out there to the public is effective. It's as effective as possible, I should say.
All right, well, we want to thank our panel today. We have just a short time left. Dr. Blatt, I'm going to give you the final word. COVID and flu, Twindemic. We'll continue to take your questions, hashtag COVID flu throughout the day if you want to submit them on Facebook. But what is it that you just feel like people need to know as you're seeing these patients and caring for them right now?
Well, I think the things that prevent COVID will also prevent flu. So I'm hoping that we only have a few more months of this as the vaccines become available, that we'll get those out there, especially to the high-risk population. So now's the time to double down. Put on your mask, socially distance, hunker down. We can get through the winter, and we'll all get to the vaccine.
And week to week, are you seeing, is it still climbing, or is it going in the right direction? Are we getting this message?
In the Cincinnati area, it's still climbing. And so, you know, just this morning, we had more patients in our hospital system than we've ever had throughout the whole pandemic. So it's really out there. It's widespread in the community. You have to protect yourself and your family.
All right, you heard the final word. We want to thank so many of you for just staying with us in the Local 12 News today at noon. I can't think of anything more important than keeping our loved ones and our families safe. If you have questions, again, hashtag COVID flu throughout the day. The team at TriHealth will continue to share them on the Liz Bonis page and on Twitter. And we're going to just say farewell and thank you for joining us.